The 1960s were an era of change for our entire country, and healthcare was no exception. The growth of employer-sponsored insurance plans made quality healthcare much more affordable. But the elderly, the poor, the disabled, they still had no access to health insurance. That is, until President Lyndon B. Johnson signed Medicare and Medicaid into law in 1965. The hospital was also touched by the social changes of the decade. Without incident, the hospital integrated on May 23, 1965. That portion of Spartanburg General, historically known as the Negro Hospital, then became the East Annex, a new area for the care of chronically ill and long-term care patients. 1 year later, in 1966, Charles C. Boone became the president of Spartanburg General. Mr. Boone's leadership heralded the beginning of an ongoing period, one of renovation, growth, and innovation.
From the day I arrived at this hospital until the day I retired, there was only 1 month that there wasn't a contractor's trailer on the property.
Programs grew and changed as well. New equipment improved diagnoses as healthcare leaders pushed for more outpatient care. The hospital worked with Spartanburg County leaders to establish an emergency medical services team to meet the growing national focus on improving emergency care. 1968 marked another historic moment for Spartanburg. Mary Black Memorial Hospital moved from its East Main Street location to a new and expansive building on Skyland Drive. During this period of overall growth in healthcare, both doctors and nurses began to specialize. At the same time, and across the entire country, hospital-based nursing training was being phased out in favor of college and university programs. Dr. Hodge and Mr. Boone rallied legislative and community support to form a local campus of the University of South Carolina, now known as USC Upstate. In May 1967, more than 150 nursing students entered the program, which was initially housed in the basement of the Spartanburg General School of Nursing. Diane Eastler, a native of St. Petersburg, Florida, was a member of the School of Nursing's last class, the class of 1969.
My admission was a little different because we had to be accepted by the University of South Carolina. And so we had to meet their standards.
During its 48 years, the Spartanburg General School of Nursing graduated 1,057 nurses. Although the University of South Carolina in Spartanburg had then taken the lead in educating nurses, Spartanburg General Hospital remained a place of learning. Spartanburg General's Family Medicine Residency Program became the first in South Carolina to be approved by the American Board of Family Practice, and only the 5th chartered family medicine program in the nation. The 1970s also brought the creation of an ambulance service, the start of our clinical pastoral education program, and groundbreaking for a $7.5 million surgical wing. Our Child Development Center opened in 1973. It immediately became a major recruiting tool.
I can remember my wife came down, interviewed, and got a job. And she called me back. We lived in Michigan at that time. She called back and said, "Sam, they have a child development center." I said, "What's the child development center?" She said, "It's a daycare on campus."
The 1970s also brought a series of local advancements in cancer care. The hospital's growing cancer division was certified by the American College of Surgeons Commission on Cancer. This certification was a reward for improved community outreach throughout the upstate as cancer doctors offered oncology seminars and lectures. These efforts also brought together a dynamic pair of oncologists whose teamwork would transform the fight against cancer in upstate South Carolina and beyond. Spartanburg native Dr. Julian Josie had been on staff for 6 years when Dr. James Bearden arrived in 1976.
After maybe a year, perhaps a little less, Jay came to me one day and he says, I'm a medical oncologist and I need to do medical oncology. I don't need to take cardiology call and I need to do my subspecialty. And I said, I don't really need to do general radiology. I just need to do this. And I can't do what you do and you can't do exactly what I do, but together we could be a team. And that really, it was about that simple. And it's been a marriage that has stood the test of time.
The two shared a passion for fighting cancer and a vision for creating a world-class cancer center.